Hello, my name is Alexa Lanier. I'm in class SHS 400 at the University of Southern Miss, and I'm doing my oral presentation on dysphagia. In my presentation, I'm focusing more on adult patients rather than babies. It is prevalent in babies, but I decided to do mine on adults. Okay, so dysphagia is a swallowing disorder involving the oral, the pharynx, the esophagus, or gastroesophageal junction. Some signs and symptoms that are related to dysphagia are drooling, poor oral management, food remaining in the oral, pharynx, or esophagus, food sticking in the throat, the feeling of food sticking in the throat. There is signs and symptoms of leakage of food or drink coming out of the nose. And then the main one is, of course, pain when swallowing. Okay. So usually if you have these signs or symptoms of dysphagia, it is important to consider a constellation of other clinical indicators rather than relying on the single signs and symptoms of what I just listed, because it could be something else. And later I'm going to go over the assessment of what SLPs do to what they do to diagnose or dysphagia. So some incidence and prevalence of dysphagia. So 1 in 25 adults experience a problem with swallowing in the United States. That number is often underestimated, and it's usually a neurological disease. Neurological diseases are known to be associated with dysphagia. It occurs in over 1/3 of patients admitted to stroke rehabilitations, patients with dementia, TBI, cancer patients who had neck and head cancer, or Parkinson's disease, or multiple sclerosis. Some consequences that dysphagia will cause are malnutrition, dehydration, aspiration pneumonia, compromised general health due to not being able to eat your proper nutrition, chronic lung disease, choking, and then even death. Patients who have dysphagia usually have a disinterest in eating or drinking, and that's due to the pain that they have. Dysphagia may result from numerous etiologies secondary to damage of the cranial nervous system, the cranial nerves, and unilateral cortical and subcortical lesions. So patients that have dysphagia, like I mentioned before, it's usually trauma to the brain, a stroke, so it starts in the brain. The brain controls everything, so that's usually how elderly patients develop dysphagia. Some more causes, I mentioned some before, are stroke, traumatic brain injury, damage to the spinal cord, dementia, amyotrophic lateral sclerosis, GERD, cancer. Certain medications can cause dysphagia, and even decayed or missing teeth. Some roles and responsibilities that a speech-language pathologist have. Speech-language pathologists have knowledge of the anatomy and physiology and functional aspects of the aerodigestive tract. So they know the normal and abnormalities of the throat. So they will first identify the signs and symptoms, and make referrals, performing assessments, and I'll go over the assessments later. They will continue education, age-related swallow function, and make dietary changes. So the assessment. You'll first go through a screening, and the purpose is the likelihood that dysphagia exists, and then it will go through further swallowing assessments. You'll start with an interview, observation, a routine or mealtime. The description of characteristics of swallowing function, the diagnosis, the safest route that you should take. You have non-oral or oral, so the safest route for nutrition. Intervention or support is given, and there is 2 types of assessment. You have non-instrumental and instrumental. So the instrumental, there's something called a VFSS. It's a video fluoroscopic swallowing study. And it's a radiographic procedure that provides a direct dynamic view of the throat, and they usually put a dye in the food bolus and watch the food bolus go down the throat. There is a fiber optic endoscopic assessment of swallowing function, an endoscopic and ultrasonography, and that shows the movement of the throat in the oral cavity. So the treatment, usually there's diet modifications made, there's electrical stimulus, equipment utensils, different utensils to help eat. There's different maneuvers that you can use. There is oral motor therapy, pacing feeding strategies, sensory stimulus, and tube feeding. So once you usually have dysphagia, it is not treatable, but there are procedures that will help manage dysphagia. So that is my presentation, and thank you.